welcome to The Extra Mile. I'm Linda Boudreau. Today we're talking about the 18th Breast Health Symposium, and to tell us about it today are Linda Rose, who's with the Breast Center of Acadiana, and Cyd Begnaud, citizen survivor. So welcome both of you. It's so good to see you both again, because you've both been on before, to talk about breast health as well as breast cancer. And it's already that time of year again. It's amazing.
October's here.
It rolls around so fast. What is it? October is what?
Breast Cancer Month.
Breast Cancer Month.
Breast Cancer Awareness.
And so that's why we have the Breast Health Symposium in October.
Right.
Well, just to kick it off, when is it this year?
It's the 18th annual, and it is on October the 12th.
Which is a
Wednesday.
A Wednesday.
At the Cajun Dome Convention Center. We have not moved locations in many years, so we're still located in the same area.
Okay.
The doors open at 5, and it's a wonderful event. We've grown every year. Last year we had over 600 people.
That's amazing that many people come out, and this year we're shooting for...
Well, we are setting up for 750.
Okay.
But it grows every year, so we just add more chairs if more people walk through the door if we don't have enough.
And luckily there's plenty of room. You have a little bit more room to grow in there, I think.
Yeah, yes, we do.
Okay.
Yeah.
So why do we have a breast health symposium?
Well, I think on behalf of breast cancer survivors, and I'm a 10-year survivor, I know when I was diagnosed, it was very hard to get information. And it was almost like a lonely feeling.
Yeah.
It was not, the Awareness Month was not as big as it is now. So you had to go to your own family physician, and it just wasn't as big as it is today. There's so much knowledge about it. And so what excites me about the event is that it's offered to women, and every year, friends, neighbors, family, you have someone diagnosed, and you can almost walk around the corner and find someone who is recently diagnosed, knows someone who's diagnosed, and can have a conversation. I know in grocery stores I'll be walking around and I'll see someone with a turban on their head, or, I didn't mind going bald, so every now and then you'll see someone who's bald, and all you have to do is smile, and that other person knows exactly where you're coming from. You don't even have to say a word. So at the symposium, breast cancer survivors can come, past survivors come, they reconnect, they get re-educated, and it's just an ongoing process.
It almost becomes a kind of sisterhood, doesn't it?
It does. It does.
A connection at a very powerful level, I would think.
Exactly. And our theme this year is We Are Family.
Okay.
Because with genetics, everybody is connected in one way or another. So we're excited about that this year, to just talk about how genetically so much has come out with that. And Linda's very aware, and with her background, it's amazing that 10 years ago, the way I was treated, it's so different today. So when I get involved in conversations, I'm in awe.
Because of the changes.
Oh my goodness, it's just, it's just great. It's really great. So, yeah.
Well, it's so important too for women to sort of take charge of their health and know more, so that they can make decisions.
And knowledge really is power. You know,
knowledge
you can't make a good decision if you don't know what's what.
Exactly. And there's great information out there now. There are organizations. There so many things that offer to women who potentially might be at high risk some real wonderful options, so that you don't have to spend, if you're in your 30s or early 40s, you don't have to spend the rest of your life in dread and fear. There's some actions you can take. And so our guest speaker this year is Dr. Retha Williams, who is a breast surgeon at Women's and Children's Hospital.
Here in Acadia,
here in Lafayette,
okay.
yeah. And she's become a real specialist as far as high risk is concerned, genetic counseling, that type of thing. So she will be a wonderful resource at our symposium.
So let's spend a few minutes talking about the risk factors then, because and let's start this by saying that just because you maybe are low risk doesn't mean to skip your mammogram,
That's right.
Absolutely
Horror of
not.
horrors, do
That's
not do
right.
that. But so what are the risk factors, and how what are we finding out about that?
Well, first of all, 1 in 8 women in a lifetime will be diagnosed with breast cancer.
So that's a pretty high percentage.
Sure.
Really, it
So
is.
being female and unfortunately growing older each year
Okay.
increases risk. So the older we get, of course, then you're reaching your lifetime percentage, and so naturally that increases risk. If you have, when we talk about the genetic risk, we're talking about if you have 2 or more immediate family members, primarily who were diagnosed with breast and or ovarian cancer premenopausally, then you really should be looking into what your risk might be, because you potentially could be, there might be some sort of a genetic connection there.
Okay.
So that's one thing.
And we identify family as mother, sister, aunt,
Grandmother, aunt.
Okay, we're looking
Right.
at the.
And
What about on your dad's side?
both sides,
Okay.
mother, maternal and paternal sides, you have to look at.
Okay.
And there's some families that it's just amazing when you start looking at it. And when you look at it and you see so many family members who've been diagnosed with breast cancer.
Let me ask this, because I know some families where there's just a lot of cancer. It's not all breast or anything. You know, there might be other kinds of cancer. Does that spill over at all?
It's some of it is connected. It seems to be a connection with colon cancer and breast, but the main thing you're looking at when you're looking at this type of risk is breast and ovarian.
Okay.
Yeah,
Okay.
those are the two. Now, some of the other, outside of the genetic connection, certainly there are studies that have proven that obesity is a risk factor. And obesity is a risk factor, sedentary lifestyle increases risk as well. So, certainly we encourage all women to just be aware of the foods that you're eating, to eat healthy, to move a little bit more. You don't have to go and exercise for, 30 minutes to an hour every day, but walk a little bit. Do some things and take those steps that will help you be more active and will help reduce your risk.
So it's the same, no matter what we're talking about, eat right, exercise, use your body the way it was designed to be used, and you're going to probably be healthier. Is that a fair thing to say?
I think that's very fair.
Okay.
10 years ago, we talked about nutrition, and it was almost like a hush-hush subject.
Really?
It really didn't have a whole lot to do with it. And, I actually went to a seminar. I had had my first round of chemo, and one of the local oncologists was talking about the different types of cancers. And she said, it's something with women with breast cancer. She said, for some reason, when they're diagnosed and they go on treatment, they gain 30 pounds. They decide they need to lay on the couch, and they need to. And she said in other cancers, they don't do that. She said, we don't understand why women go that route. And it was very empowering to hear that, because weight is an issue. And as much as we don't want to think it is, it is. And so it made me, even in my treatments, to say, okay, so I really need to watch this. So the more we get about nutrition out there, and women have more to work with, they want to do something to fight the disease. And that's one very, very important factor.
And it's something that we have control over. We can determine what we eat.
Right.
Didn't
exactly.
you have a nutritionist at one year at your symposium as your keynote speaker?
We did, yes.
Yeah.
That was several years ago.
Yeah.
She came and gave some ideas on, and there's different levels of nutrition. You can go from one end of the spectrum to the other, and I think that most physicians just kind of want you in the middle. They just want you to live a healthy lifestyle.
Balance
and get
is
your
good.
fruits and your vegetables in. Balance is the key.
Balance is
That's
good.
exactly right.
The exciting thing about the studies that have been done as far as exercise is concerned is that it actually has been proven in young women if you exercise on a regular basis, it can lower your risk by 45%.
Oh my gosh,
That's
huge.
Huge. So
even
so
if you have
certainly-
like a genetic predisposition,
no,
because I mean,
no.
but
No.
predisposition is just that, isn't it? If,
Yeah,
you,
it
if you
is.
have a marker,
It
it
is.
doesn't mean you're marked.
Right,
It means
right.
you've got a marker.
Right. Well, the thing is, if you carry the gene, no matter what you do, unfortunately, your risk, if you have BRCA1 or 2, which are the two genes associated with breast and ovarian, your risk for breast is about 60 to 80% of developing breast cancer.
No matter what lifestyle changes you make.
Yeah,
So,
I mean,
okay.
certainly if you're obese, then
Then you go
that
to
could certainly
90%.
increase
Yeah.
increase the risk.
Okay.
But you already are at that risk. But for us, normal, what we think healthy women, it's to me amazing and empowering to think, well, geez, if I can control that. And it's especially true in postmenopausal women.
So stay
there
active.
is a higher risk in postmenopausal, and certainly again as you grow older, if you have a weight gain, that it will increase your risk.
So
the
stay
message
active.
is
Yeah.
stay active, right? Eat, eat healthy foods and balanced foods. So
But with the gene, the genetics, Linda, even though you carry the BRCA1 and 2 gene, there's so much intervention now that can be done if you find out, because fear sometimes will keep us from really wanting to know the truth.
Well, that was it. I was thinking, if there's nothing you can do, why
Right.
would you even want to know?
Right, and early detection and just getting genetically tested. And I don't carry the gene, so my
Were you
family.
tested?
I was tested,
Okay,
yes.
okay.
And we have a high history of cancer in our family, but other types of cancer. But along the course of the way, my family was in a lung study in New Orleans because my family, my mother, her brothers, everybody's had lung cancer. And there's actually a gene that they have termed that is connected to breast cancer. So you may have breast cancer and not lung cancer, or you might have both, but that gene is very common in both of those cancers. So that was very interesting to find out because we have a very high incidence of the lung cancer. So of course I'm more alerted to the fact of having lung studies
Right.
and all those things done. But with carrying the gene, there's so many things that can be done now as preventative measures that
Okay.
it's awesome. It's just wonderful that we didn't know about.
So it does give us control over our lives.
Absolutely.
oh, absolutely. There's certainly there's medication you can take.
Really, just to keep
like
to keep it-
tamoxifen, for example, raloxifene. Those are
As
prevention.
Really?
Yeah, lower risk, about 45%.
Wow.
Now,
What
of
about
course,
side effects? Are you taking like milder doses of it?
you're gonna. I mean, for young women, you're going to have like a menopausal type of reaction, so the
Okay.
hot flashes and so forth, which makes it not real appealing, certainly
But
for
hey.
young women,
Right.
but
Yeah.
lowers your risk. And certainly the other more drastic measures would be bilateral mastectomy, which is removal of the majority of your breast tissue, as well as an oophorectomy, removal of your ovaries. Because remember, they're connected. So I attended a conference back in June, and it was sponsored by this wonderful organization called FORCE, Facing Our Risk of Cancer Empowered. And I met the most fantastic young women who had made a decision to have bilateral mastectomies, were putting off the oophorectomies until they had completed or finished their childbearing years, but were so empowered because they had made that decision, because now they've lowered their risk 90+%.
Okay, so just by making a decision like that, you can prolong your life significantly.
Absolutely.
Yeah.
It's a hard decision for a young woman.
Well, it's
to
a hard
make.
decision
Right.
for anyone, but
Right.
when you look at the odds,
Right.
you know.
Right. Exactly. Exactly.
Yeah.
So these kinds of messages, you know, to get out there are just, to me, so powerful. I'll never forget, I was at an event here in Lafayette, and a 28-year-old, we had a booth, we were displaying our information, and she came to me and she said, can I spend a little bit of time with you? I have some questions. And she had a huge history of breast cancer in her family, and she had one daughter. See, that makes a difference too.
Yeah.
She had a daughter, and so she said, I just want to know. I just am at a place where I want to know. So the long and wonderful story about all of this and her wonderful results were that she was negative for the gene. She did go through the testing.
Okay.
She was negative for the gene, which was great news for her and for her daughter.
Because if she's negative, then her daughter will be
That's
negative,
correct.
so it doesn't skip a generation?
Usually not, no.
Okay.
No. Normally, if mother or the person, you know, tests negative normally, then you have a clear bill.
So that must have been a huge relief for her.
It was huge. And then, you know, her husband was hoping that they might conceive another child. So she's like, okay, now I'm ready for this. But
Yeah.
before, her life was on hold.
Yeah, because she didn't know.
And she, you know, just wanted more information. So it was just great. It was very positive.
And I have a daughter, and that's the reason I did the genetic testing, just to make sure, you know, that if I did have the gene, that we could start working. But then I have a friend also that the mom, there's no family history, but the daughter has breast cancer. That's very young. So, you know, early detection is the key.
That's right.
The tamoxifen, and I just found this out, in deciding on whether, and you talk about young women and putting them on them, there's now a test you can do to see whether your body will absorb the tamoxifen or if you're actually taking it for no reason.
Oh,
That's
so not
true.
everybody
That's
absorbs
true.
it then.
So
That's very
the 5
true.
years I took the tamoxifen, I had not had the test, but in trying to decide whether I should stay on it or not, did the test, and I do absorb the tamoxifen. So it would be a good thing for me, but had I not, then I would have, you know, so there's
Right.
so many tests out there that can be done, and early detection is the key.
Now, are a lot of these or all of these tests available here in Lafayette? In other words, can we get the genetic testing here and the tamoxifen testing here and all of those
Yes.
kinds of things?
That's the wonderful thing about our community. Our community. And what I was going to point out too is that for this symposium, our community comes together. It's a community event.
So it's not
and-
one hospital or another hospital
No,
or one
it's-
doctor or another
it's
doctor. It's all of
all
us
health
together.
care is represented. So women can get information from all these different sources, you know. My specialty is comprehensive breast imaging. I know a little bit about other things, but that's my specialty and my center specialty. But you have wonderful centers who do the oncology, the radiation oncology, the genetic testing, who are at this event to disperse their information and pamphlets and all brochures and things that really can help women make wonderful decisions.
And I did experience that last year. Apart from the symposium, of course, as you said earlier, every organization wants business for what they do and how they do it. But there was a couple of people at the last symposium, and there was a lady at one booth that was talking about imaging, and because of other questions coming about, they actually said, no, go talk to this booth and go talk to this booth. And just to see that going on, it's like they just leave it all outside the back door when they walk through the door, and then everybody's on the same page. So whether it's surgery, radiation, chemotherapy, they're going to lead you to the right person to get your information,
So,
which is
wow,
really
that is
rare.
wonderful, and it speaks volumes about our community, I think. You know, because this something like this doesn't happen in every community, does it? Like our breast symposium. I mean, we're one of the few communities that I know of that has an event like this.
I'm not aware. I think Baton Rouge does hold a symposium also, but we just find out
But
which is
one-
the best. So.
Well,
Yeah.
I know that. I mean, I know that's true.
And as large as it is,
That's
I
the
mean,
thing.
It's so
And
huge.
as comprehensive as
and
it
as
is.
comprehensive as it is. I think it's really a great gift to the women in our community. I truly do.
Well,
And
the first year that it was held, I was a model after the first year, and I think there were 200 maybe plus people. And so it just, you're right, when you say it speaks volumes, every year just brings more and more people out.
it does. And is it because breast cancer is on the rise, or is it because of greater awareness?
Well, most of it is because of greater awareness, because of the technology today to detect breast cancer at earlier stages. Certainly, we're able to do that,
Which is good.
Right, which is a great thing. The reason our wonderful area needs to really focus on this is because we're in the top 5 nationally for, unfortunately, leading the way in breast cancer mortality, which means that we're not getting women screened at an earlier stage. And so what we're trying to do is trying to get that message out there, remind women that not only mammography is important. It's the gold standard now for screening breast tissue, but also the breast self-exam, which is very controversial in many circles, but it honestly, many women find their own lumps.
Women know we all know our own body better than anybody else knows it.
Correct.
So we're the ones that know there's something wrong, with ourselves.
Correct.
Yeah,
and most women will say, I just knew something was wrong.
Yeah. Yeah.
So that, and of course, regular visits with your physician, who can do a very thorough, what we call clinical breast exam. So they can really examine your breast tissue, and you may not feel like you're being as thorough as you can be with a self-exam, but a physician will do a very thorough breast exam. So that really should be done annually as well, and then the self-exam monthly.
Do we have any idea, why women are not taking advantage of these opportunities? Why we have such a high mortality rate? Is it poverty?
Poverty's part of it. Poverty is part of it. Fear of the procedure is one thing, and fear of the results. If you had, a family member who died of breast cancer, you may have horrid images and think, well, if I'm diagnosed, I'm going to die.
Okay, but is this a chance for us to say that's not necessarily so?
Oh, it's definitely. If it's detected early, your survival rate is 98% most of the time, depending on the composition of the lesion as well. But the majority of the time, detected early, 98% survival rate.
And we celebrate survivors every year.
The birthdays get better and better. They really
Exactly.
do. I've had friends tell me, and I think this is where some women, I had my mammogram done, and they don't do the self-breast exams. And depending on what type of lesion it is, it may be an aggressive tumor, and you may have had a mammogram done 2 months ago and think you're fine, and 2 months later you may feel something that's not quite right, and they may diagnose you with a small tumor. But once you have the mammogram, if you wait for an annual return and don't do self-breast exams, and you have an aggressive form of breast cancer, then it might be too late.
Okay.
So
So you
it's
really
very
have to
important.
pay
That's
attention.
why we promote the 3 things that I just mentioned. The other thing is that there are so many great screening programs available, free mammograms. And those programs are available right here in our community.
So income and insurance are no
financial
excuse.
should not, no. A financial, because for women who are uninsured or underinsured, which means if you have a catastrophic policy that you're going to have to pay out of pocket, then this is an opportunity to have your mammogram.
So do that. We have just about 30 seconds left for today. So again, I want to just give us the dates again of when the symposium is going to be.
the symposium will be held on October the 12th. The doors will open at 5 o'clock. We will have vendors from around the area that will be there to share their goods of what they perform and their services from their entity. We will have a guest speaker. She will be speaking on We Are Family and genetics, and we welcome everybody. It's free of charge, will cost you nothing. All you have to do is show up.
So come one and all. Linda,
Yes.
Cyd, we're out of time. I want to thank both of you for being here today.
Thank
Thanks
you
for
so
having
much.
us.
And thank you for watching The Extra Mile.